One of the most rewarding things about what I do is being able to get people back to what they like to do, so their livelihood. So it could be someone who just wants to be able to walk their dog around the block, or it could be someone who's going back into competitive sports. And to be able to see the progress from coming in and not being able to walk, not being able to lift their arm, to then be able to really achieve something, I think it is really rewarding on a daily basis. My name is Alexis Colvin. I'm an orthopedic surgeon. I treat shoulder, hip, and knee injuries, both surgically and non-surgically here at Mount Sinai. I'm able to be a physician in so many different aspects. So I work in the office and see patients. I'm in the operating room doing surgery. I travel with the US Fed Cup team as their team physician. I work at the US Open, which is one of the largest sporting events in the country. And all these I'm working as a physician. I think one of the important things for me is that I always want to be better. And so whether that's in the office or whether that's in the operating room, and there are a lot of ways to get to that point. So the lessons that I learned by working with professional athletes, I can take those and filter that down and translate them to what can work well for my patients in the office who are at a slightly different competitive level. That in particular is really rewarding, that being a doctor can touch so many different people on so many different levels. Most of the surgery that I do is arthroscopic surgery, which is minimally invasive. And so you make a small incision about the size of a centimeter and you put it in a very thin camera, and you're really able to see everything with that thin camera. The benefit of doing the minimally invasive surgery is that patients have less pain post-surgery and they're able to recover faster. A lot of research is going into developing tools to make parts of whatever joint you're doing surgery on more accessible and also to help heal things faster. I think probably one of the strongest motivators is being able to use other patients as examples. And one thing that comes to the top of the list is weight loss. So it's definitely an issue for a lot of people. A lot of times what will happen is I will see someone in the office, they're overweight, and then I won't see them back for 8 or 9 months, and I almost won't even recognize them because they will do some sort of weight loss plan and their knee pain is gone and they're coming in for something completely different. So I think being able to use real life examples that someone else can do it, because nothing beats really being able to talk to someone who's gone through the same thing you have. You don't have to be a professional athlete to necessarily see a sports doctor. At least my philosophy is that I'm going to treat someone no matter what level they're at, because they have a goal as well. And I think it's just as important to want to be able to run a local 5K as it is to win the US Open.